Hello everyone, welcome back to our channel. I am Dr. Suraj Chirania, hematologist and hemato-oncologist and bone marrow transplant physician. Today we are diving into an important topic, how platelet disorders are linked to blood diseases like leukemia, bone marrow failure and myelodysplastic syndromes. We called it as MDS. If you or your loved ones has ever faced abnormal platelet count, this video is for you. Let's get started. How diseases affect platelets? Platelets are produced in the bone marrow. So when there is a problem with blood cell production, platelets are often affected. This can lead to thrombocytopenia, low platelets, increases the risk of bleeding. Thrombocytosis means high platelets, increases the risk of clotting. Platelet dysfunction, when platelets are present but they don't work properly. So let's explore some of the most common diseases that impact platelet. First, leukemia and platelet abnormalities. So leukemia is a cancer of blood and bone marrow where abnormal white blood cells multiply uncontrollably. This crowd out normal platelet producing cells, leading to thrombocytopenia, means low platelets. Signs to watch for: frequent nosebleeds and gum bleeding, easy bruising, small tiny red spot on the skin. Treatment usually involve chemotherapy, targeted treatment, immunotherapy or bone marrow transplant depending on the underlying cause. However, platelet transfusion are often needed to manage a severe bleeding. Second, bone marrow failure syndrome like aplastic anemia and myelodysplastic syndrome. When the bone marrow fail to produce enough blood cells, it can lead to low platelets and increased risk of bleeding. Two major condition includes aplastic anemia, a bone marrow problem where it stop to produce the blood cells leading to severe thrombocytopenia. Second is myelodysplastic syndrome, a disorder where blood cells including platelets don't mature properly. Some cases may progress to leukemia. Treatment approach is immunosuppressive therapy for aplastic anemia and bone marrow transplantation for severe cases of aplastic anemia. Supportive care like platelet transfusion and growth factor therapy can be needed to tide over the crisis. Third, myeloproliferative neoplasm, we called it as MPN, and high platelet count. Unlike leukemia and MDS, some blood disorders cause too many platelets leading to thrombocytosis and high risk of blood clots, stroke and heart attack. These conditions include essential thrombocythemia, a bone marrow produces too many platelets without an obvious cause. In this category, other problem is polycythemia vera, a disorder where red blood cells and platelets are overproduced. Treatment strategy includes low dose of aspirin to prevent clotting, cytoreductive therapies like hydroxyurea and agrelite to reduce the platelet counts, regular blood monitoring to prevent the complication. So next question is, when should you see a hematologist? If you explain unexplained bruising or prolonged bleeding, frequent nosebleeds or gum bleeding, symptoms of stroke or blood clots, it's very crucial to consult a hematologist for early diagnosis and treatments. That wraps up today's discussion on platelet disorders in blood diseases. If you found this information helpful, like, share and subscribe for more hematology contents. Do you have any questions about platelet disorder? Drop them in the comment box. I would be happy to answer. Thanks for watching. Until next video, stay healthy, stay informed.